I would like to welcome Alison and Lee today from Eastern Health. We've got a fairly packed session, so we are not going to muck around too much. We're going to get straight into it. So I might ask Alistair and Lisa to turn their cameras off. Yeah, they've gone just like that. So today we're going to talk about senior leader Gemba habits for medical and nursing leaders. Alison is the Chief Medical Officer at Eastern Health, and Lee is the Chief Nursing and Midwifery Officer at Eastern Health, and they're going to tell you their story about Gemba. But before that, I just wanted to go back to the Lean Transformation House for a minute. And, you know, we've talked quite a bit about the Lean Transformation Framework and the house, and this metaphor that depicts the 5 dimensions of how an organisation brings about the change to create a high-performing organisation that's really focused on delivering customer value. Well, I imagine that in every house there's a bike, and you know this bike's got, you know, it's a bit more of an active metaphor because you've actually got to get on the bike and ride it, and the bike, which is very much used at Stanford Children's Health as a metaphor for the lean management system, you know, really starts to talk a little bit more about the how. So we've got a steering wheel, which is getting us towards true north. We've got a back wheel, which is all about the big improvement that we do. And we've got a front wheel, which is more focused on the daily management system. And we know that the way that this works is that sometimes, you know, in our daily work, we come across something that's too big, and we have to kick it back to the back wheel, and vice versa. Sometimes when we've been working on big improvement, we start to embed the change, and to go about sustaining it, we will kick it into the front wheel. So during the time I was at Stanford Children's Health, I was really trying to learn as much as I could while I was there about how this daily management system worked, how the front wheel worked. And I got a little bit frustrated with the textbooks I was reading and the theory that and the articles I was looking at. So I had to go at putting together the elements of the house myself. And I think it's really a system of things that work together. So not going to go into it in too much detail, but, you know, we've got standard work around the outside in the tyre, and that's where the rubber really hits the road in terms of the day-by-day practices. We've got a couple of processes there, important processes around solving problems and recognition, some enablers that help us in our daily management system, such as huddles, visual practice, important protected time. And then there's some practices on the left-hand side, things that our leaders and teams do. And we've got frontline leader standard work, something that we know that's really, really important in terms of maintaining and developing a lean management system. And then we've got the habits of our senior leaders, which I've chosen not to call leader standard work, because we know that a lot of what our senior leaders have to do on a day-by-day basis can be very non-standard. But there are things on a day-by-day basis, habits and practices that they try to embed in their work to, you know, really develop that lean management system. And that's what today's session is all about. So Alison and Lee both live in Melbourne. Melbourne is famous at the moment for being, you know, the city that's been in lockdown for the longest. And finally they've been released. It's a big city. It can experience 4 seasons in a day. It's got a very high vaccination rate, which the city and the state's very, very proud of. And as you can see there, Eastern Health is a big service, does a lot of episodes of care, has a lot of staff, and has multiple sites. So with that, I'm going to hand over to Alison to talk about Medical Leader Gemba.
Yeah, thank you, Denise. So look, thank you for the opportunity for us to share our lean journey that we've been on. And really, as Denise has outlined, the executive at Eastern Health is aiming to transform our organisation using lean methodology. And personally, both Lee and I have embraced the principles behind it, and we are trying to live and breathe those principles. Denise, if you could take me through to the next slide. Probably as our challenge, though, as individuals, our actions are observed by our whole organisation, and the actions of one do affect many. So what we choose to do and how we live and breathe, these are incredibly important within the organisation. During last year in 2020, Melbourne experienced its second and longest COVID lockdown, and we did work remotely. A number of our health services and a number of our organisations went to work remotely. And our Premier at the time did say, if you can work from home, you should. So the executive ourselves, we transitioned to working in a hybrid environment, and some of us did work off-site for a period of time. During that time, we did survey our staff, particularly around leadership, around wellbeing, were there things that we could do in the COVID space to really understand how we were supporting our staff. And one of the indicators that stood out for me was that there was a perception from our staff that senior leader visibility wasn't where we wanted it to be. So only 58% of the medical staff provided a positive response around our visibility of our leadership. As Denise mentioned, Eastern Health is a major tertiary teaching hospital across 7 hospitals, 3 emergency departments, 2,800 square kilometres, 9,000 staff, 1,700 medical staff. So the question for me was, how can one person, little old me, increase their visibility to those 1,700 staff in a hybrid environment with the lockdown restrictions? And really, that was where lean was a great platform to then be able to lean on. And really understand what's the role of Gembas. So I had a good look at the literature, noting that Gembas are encouraged for leaders to return to the floor. So I pondered, was there a way that we could utilise the structures of Gembas to actually return to the floor and increase visibility? Next slide. So the aim really was to facilitate visible leadership amongst the senior medical clinicians, and doing that via regular structured Gembas. It was a personal learning experience, but it's also an ability to connect with the floor and be very visible out on the floor around connecting with the staff. The challenge was I needed to be systematic, I needed to be targeted and try and spread across the sites and the programs. So from January of this year, I worked very closely with my PA, who, by the way, everyone knows is your right-hand person, to actually really schedule the walkarounds. We made sure that we tracked it on a weekly basis of where I was going and what I was doing, and also try to balance the specialties that I was able to visit and the sites. One other thing is that I, as a number of you probably do as well, I've got a newsletter that goes out on a weekly basis to the medical staff within the organisation. So although I'm camera shy, I made the effort every time I went out to take a bit of a selfie and then put it up on the newsletter on a weekly basis to really try and share the visibility of what we were doing. Next slide, please. So over the 4 months, the visits varied depending on the clinical service that I was visiting, but also what the particular clinical director wanted to showcase. I spent time in theatre scrubs. I observed an orthopaedic laparoscopy with our head of orthopaedics. I learnt about anaesthetics registrar supervision with the anaesthetist in charge. I was able to go out to general medicine and look at their new ward round process that they'd implemented. and I was also able to spend some quiet, reflective moments within palliative care as well. I spent some time in outpatients. I walked down in the emergency department, and I was in awe of the complexity of the cases that we're seeing within ICU. I got to see in paediatrics, they have a little car that you can drive the children off to theatre. And I was able to spend some time with our mental health clinicians to really see what those challenges are in the community setting. So the challenge was, though, that those visits were often in person, and particularly when we flipped back into lockdown again fairly recently, you can't stop the Gembas. So those Gembas I then switched to a virtual format and really tried to connect with the teams on the ground through a virtual format. The challenge was that I thought I was doing the right thing, and anecdotally I heard that it was a good thing, but I really wanted to understand it. So I did put a research eye on it as well. So Denise, can you take me to my next slide? So after seeking ethics approval, I conducted a survey of our clinical directors and really asked them, what is that visibility of leadership looking like now? And also I explored some concepts around trust and wellbeing, which are important for the frontline clinicians, particularly in COVID. I assessed their perceptions on a scale of 1 to 5, 1 being negative, 5 being positive, and looking at the 4 indicators that I've got on the graph there, the junior medical staff in yellow was probably the highest response, senior staff in grey, whether or not there was an impact on the unit and whether or not there was an impact on the organisation in orange. So certainly with a very high response rate, I was able to get 37% of my clinical directors to respond. It became very clear that there was a very strong positive perception amongst the staff around the visibility of the Gembas. Next slide, Denise. So what have been my learnings? My learnings really have been that one person can make a difference. Even such a very small change of instituting regular weekly Gembas has had a huge impact on the organisation. Not only was it an opportunity to share visibility, but also I learnt an extraordinary amount from seeing, from observing, from being on the front line and really having that connection to the front line. The ability to include photos and share the experience within my weekly CMI update was pretty amazing too. And I got a lot of positive feedback of being able to share those little selfies as I went around. I have incorporated some of the feedback from the Gembas in our executive daily huddles and commenced role modelling for some of our medical leaders as well. So I'm trying to encourage a number of our medical leaders to do this as well. Probably my last reflection is that walking the floor at regular and predictable times really does have an eye-opening, humbling and soul-enriching experience for me as a doctor, but also as a leader. And it's really shown me that a small change of instituting Gembas can have a huge impact across the organisation, even in a hybrid environment in COVID. So that's been my story, and I'll hand you over to Lee, who's going to take you through her story as well.
Thank you so much, Alison. The first thing I would say about Gemba, can you move on to the next slide, please, Denise? Thank you. Is Gemba for me is like being on the balcony and the dance floor. You know, this is something that we want to do as leaders. We want to have that balcony view, but we also need to understand what's happening on the dance floor. So I Gemba in 4 different ways, and I'd just like to share how that works with you today. The first is the standard Gemba, I think, the pre-arranged visits, or you know, where you're popping into the floor and you're wanting to see what's going on. Before I even took this job, I did a Gemba. I did a Gemba to go and sit in the cafes, because that's where you pick up culture better than anywhere else I know. I just sat and listened. How did the staff talk to each other? I asked a few questions of the cleaning team that were around. You know, I Gemba'd before I even started. Then when I go around on my pre-arranged visits or my pop-ins with my team, I make sure that I focus on listening rather than solving problems. I do tend to like to jump in and pull out the old Superman cape and think that I can fix things. So for me, that's a great lesson in restraint and something that I have to be honest, I'm still learning. My second way of Gemba is virtual meetings and huddles, where I sit in with other people's huddles, where I sit in with lower tier huddles in my team. And I use this Gemba to fill in any gaps in knowledge I might have, and to learn from others. It's a really great way to pick up what other people are doing, and I find that are really useful. So for me, those two elements of my Gemba are probably more the dance floor. Sorry, it's probably more the balcony. The dance floor is probably more 3 or 4, which is the site stays and sitting on the floor. So what does that mean? About once a week, we move around to different sites and we borrow an office and we work from there. Most of our meetings now are virtual, and we use this as an opportunity, and I find it really valuable to pick up on culture, to go again and have lunch in the cafe, to meet with people, to talk with people, and to just get that longer view of what's going on at a particular site, and actually understand the challenges that people face in their particular environment. The thing that I love doing most, the best Gemba for me, is when I do a shift on the floor. When I do an AM, a PM, a night duty, when I do shifts in other sites, in other areas, apart from those that I'm comfortable with. And I find that really ideal to understand those really deeper constructs and to understand flow. I always work as a supernumerary. I don't, actually that's not true. I've been doing PPE shifts, PPE spotter shifts. So I am actually part of the team sometimes, but usually it's as a supernumerary team member, so that I can get around and ask questions and really do that work on understanding how processes work and what's not working for our particular team. When I do Gemba, I think what's really important here is connecting with people first. The last thing in the world we want to do, and I have to say that Alison and I we started quite early on before COVID outbreaks sort of messed us up a little bit, but we started Gembaing together as the professions, and that's something that we're really keen to continue, because it shows collaboration. It shows that we want to work as a multidisciplinary team, and I think it role models those behaviours right from the executive, and that's important. But connecting first is really important. I have seen leaders walk into a ward and go straight to the board, to the performance board, and start asking questions. And I do find that people start to get defensive. And that's not what this is about. This is actually an opportunity for us to hear what's the pebble in their shoe, what grinds their gears, what's working for them, and what are they most proud of. And if you build that connection first, the performance board then is a natural progression, and they actually want to show you what's going on, and they'll talk to it with much more detail than if you just go there first and start the Gemba from that point. So I would encourage you to just turn it around a little bit if you get the opportunity to do that, because that certainly worked for me. I hope I'm actually not going to get, if you can move on to the next slide, I hope I'm actually not going to get upset about this next slide, because this was written before. We've very recently actually, just lost a staff member at Eastern Health. And can you move on to the next slide, please, Denise? Thank you. And I think that really highlights why this is so important in our Gemba visits. And I know that Alison, and I know that Gail, and all of the professional chiefs that function at Eastern Health do so with a focus on workforce safety. It is incredibly important to us, and patient and workforce safety is a real priority for us. And no matter what we do, we tend to want to use that lens to look at all of the problems and the processes that we come across and that we encounter. We did a lot of work around workforce safety, and I am really proud to say that we we made a difference, I believe, you know, with fit testing and N95s, and we introduced a new program called Blue Mirror, which uses artificial intelligence to help people with their donning and doffing. And we were able to, as a country, we were able to reduce our healthcare worker infections from 21% in 2020 to 1.9% in 2021. That doesn't help when we've just lost one of our own to COVID. And you know, it just goes to show, I think, just how important this work is that we do. And it really has focused me, I can assure you, and I'm sure it's focused my other professional colleagues on making sure that we continue our Gemba with a workforce safety lens and priority. Next slide, please. One of the things that you pick up stuff when you're doing your shifts that you would never pick up otherwise. And I'll give you an example, a bit of a story around that. This lovely gentleman that I'm presenting this award to, this is one of our recognition awards at Eastern Health. And this lovely gentleman is an amazing gentleman who is a nurse in our ICU. He's a clinical nurse specialist, and he has done a lot. He's actually trained as a cardiac technologist, and he has done a lot to introduce ECMO into our service, and ECMO has saved, I think in our service alone, 32 lives. Like, it is an amazing intervention, and he has done an amazing body of work to introduce this to Eastern ICU and to upskill our staff so that we can manage our own ECMO at any time, 24/7. But what was happening when I was in a Gemba doing a shift there was I noticed that he was doing a lot of work as a cardiac technologist, when in actual fact he was on a shift as a registered nurse. And when I came back and did some testing around that, he actually didn't have that as part of his advanced scope of practice. So as the professional chief, I was able to meet with this person and sort of explore that a little bit, very casually. And we then determined that he would really love to do and embed this body of work into the work he's doing as a nurse. And so he is applying to be a nurse practitioner with an advanced scope of practice now, and making sure that then he's legally covered to do the work that he was doing, and that he feels that he's being supported by the organisation to succeed and to continue in his career pathway. So I would never have known that if I had just popped in, you know, and people weren't aware that that was a risk both for this individual and for our organisation. So that, I think, is a really good example of how different Gembas are able to elicit different information and support you in your role. I think that that's fabulous. Next slide, please, Denise, and we'll finish off. I'm aware that people have probably got some questions. I just wanted to share this photo with you. This photo was very, very early in the pandemic. And this was as a result of a call from the Department of Health to send out a team because they had closed down one of our public sector high-rise flats because they had a COVID outbreak there. Face masks, as you can tell, were not the norm. We had to bring our own PPE, and there was very little structure, and there was very little oversight and scene control of this. It was really quite chaotic. We were very lucky that we were able to, do the screening and apply our own safety measures to keep our team safe. I went along because I felt it was an uncontrolled environment, and I really wanted to understand if our people were going into a situation that would put them at risk. So, I certainly didn't feel the need to go every single time, but just going maintaining that contact with your teams, and going to the floor and finding out what the challenges are. I was able to feed back to the department that they really needed to get their incident command system in play here, and there was lots of additional benefits that I was able to provide being a leader on the floor. But I cannot tell you how wonderful it is to build those bonds with your team, and they are much more likely to come to you in the future if they've got concerns about something, or something is not working for them on the floor. So I'll close it there, and thank you so much for the opportunity. Alison and I have really enjoyed sharing our stories with you today.
Great. Well, thanks very much to both Lee and Alison. We have a question here from Jan Rice, who says, can you explain how you use the Gemba visits to help solve problems, and in particular, what attributes you bring to those situations? And I think it's a question for both of you.
Jan, a really good question, and I have to say one of my biggest challenges, because the first thing I want to do is to try and solve. So I have and I am learning the art of inquiry, humble inquiry. I've been reading a great book that I think, Jan, you recommended for me, actually. So for me, it's really around pulling together the information and identifying where exactly the pain point is. We've been doing a lot of work on capability building in A3s, so that we spend the right amount of time in that left-hand side actually understanding what the problem is before we move to that solution mode. We've been doing that as an executive, and we're starting to do it now. I'm building that capability within my team as well, and starting to do it within nursing as a discipline. So, I think that we need to keep it as simple as it can possibly be, but making sure that we really understand what the problem is that we're trying to solve, and don't think that we've got the answers. The people on the floor have the answers, is my experience. It's really around harnessing and putting an environment in place where we can understand that. Co-design is a passion for me, and I believe that we're getting much better at co-design, and Alison can probably talk to that within the medical profession as well.
Yeah, thanks, Lee. So again, very similar to Lee's approach, you become a coach. So you actually have to actively take off your boss hat, and you have to actively put on your coach hat. And when you're having those conversations with the clinicians on the ground, it's then about, tell me more. Why do you think that is? Let's have what data do you have now that shows that, so that you don't end up trying to jump to a solution. So it's actually an active process to take off your boss hat and put on your coach hat. Yeah.
Great. Thanks to both of you. We have another one from Jane Evans. If you had one message to give leaders who don't know about Gemba walks, what would that be?
For me, it would be, I don't know how you lead without it, to be honest. I don't know how you understand what the problems are of the people that are part of your team. I believe Gemba is transformative. I think it is the tool in a leader's toolbook, or tool, I can't talk today, tool belt, that is one of those foundational pieces. I could not lead in what I would consider to be a authentic way without Gemba.
Probably my one thing, Jane, would be as an executive, you see a lot of briefing papers, you see a lot of reports, you see a lot of analysis, but the richness is actually seeing it with your eyes. And it's not about not trusting what's in the report and what's there. That's the machinations of business. You have to do that, and that's how hospitals run. However, being able to see it, to feel it, to have that conversation with the clinicians on the ground is the richness that you don't get in a report, and that's the value of Gemba. Yep.
Great. Well, thank you to both of our speakers. We're out of time, and you've been saved by my question on balconies and dance floors. Some great insight. Thank you very much.
Thank you so much,
Thank you,
everyone.
Mike.
Bye-bye.
Bye.
Bye.